Hi, everyone. My name is Elizabeth Dietra Buxton. I'm a physical therapist at the UNC Center for Rehabilitation Care in Chapel Hill. And today I'm going to be talking about physical therapy and exercise for folks with Parkinson's disease. So first, let's just talk a little bit about what physical therapy is. Some people may have been to physical therapy in the past for, an orthopedic problem like back pain or knee pain. I think it is helpful to know that we have lots of different types of physical therapists, just like different types of doctors. So, ideally you would go to an orthopedic physical therapist for your knee pain, and you would come to a physical therapist that specializes in neurological problems for your Parkinson's disease symptoms. So whenever possible, do seek out someone who has experience working with people with neurologic conditions, and particularly Parkinson's disease. Physical therapists are movement experts who hopefully improve quality of life through exercise, hands-on care, and education. On the first visit, we do an evaluation. We spend a lot of time talking about your history, kind of your day-to-day activities, and then we do an assessment where we might look at your strength, flexibility, posture, balance, and walking. And then we'll determine what our goals are for physical therapy, and that will be a combination of the goals that the physical therapist kind of generates, as well as the patient's goals. Over the course of physical therapies, we'll work on developing an exercise program to address any of the movement problems that came to light during the evaluation. We'll probably ask you to do exercises in conjunction with physical therapy, and then we'll give you exercises to do even after you finish with physical therapy to maintain the improvement that you make when you're working with us one-on-one. We'll also work on providing education and exercises to prevent movement problems. We really do want to try and keep people from developing some of the issues that we commonly see in Parkinson's disease, rather than waiting until, you are, for example, having a fall or noticing that you're, losing any kind of range of motion. We also work on connecting patients to local resources for health maintenance. So this might be different exercise programs in the community, might be someone like, massage therapists, could be social worker, or different kind of healthcare workers. We work with you to build your team. Next, we'll talk about some of the most common problems that I tend to see in people with Parkinson's disease. So one of the big problems that I notice are slow and small movements. And particularly, we can see this with decreased arm swing on one side of the body, in addition to smallness and slowness in other movements as well. We tend to see postural problems. So for example, folks that have kind of those, rounded shoulders, and sometimes people will start leaning a little bit to one side. Another common problem is stiffness, particularly in the neck and torso. And then people tend to complain about balance problems, particularly when they're multitasking. So trying to, for example, walk and at the same time talk to someone, or walk and at the same time carry something. We do have a lot of interventions that we use to treat those common problems. So for example, when we notice the slow, small movements, we work on trying to add more effort to those movements. We try and work on exaggerating those movements. For example, if we notice that someone is having a hard time standing up, let's say that instead of leaning forward and standing up completely, they're starting to lean forward partially and then sort of fall back in the chair. We might work on exaggerating that forward lean in order to come all the way into a standing position. If people are complaining of having a hard time rolling over in bed at night, we might work on having them sort of punch their arm across their body as they roll, rather than just sort of reaching slowly across their body. And then for walking, we'll work on having them exaggerate that arm swing. So bringing their arm all the way past their front pocket and then all the way behind their back pocket. Sometimes it feels kind of silly at first to do that much arm swing, but typically it kind of looks more normal when you're doing the exaggerated motion compared to what feels like a normal amount of motion. In order to address the postural problems, we typically will work on strengthening the muscles in the back of the body and stretching out the muscles in the front of the body. And that could be through just, kind of typical strengthening exercises with weights, or sometimes exercises that incorporate different stepping movements. In order to work on the stiffness, we usually do flexibility exercises, and we focus a lot on exercises involving trunk rotation. So it could be, doing some exercises where you're sitting and working on rotating from side to side gently, or it could be lying down and working on rotating the legs to one side or rotating the arms to one side to keep that stiffness from building up in the neck and trunk. And then for the balance problems, we'll work on balance exercises that are specific to the scenario where, our patient is complaining about losing balance, or where we tend to notice that. We often will also work on multitasking, because we know that practice with multitasking leads to better multitasking. So for example, we might work on, walking and remembering something. We might work on walking and tossing a ball into the air, or walking and maintaining a conversation. And then sometimes we'll teach people to use equipment like trekking poles or rollators that just help to take some of the pressure off of the walking, so then they can focus on the other tasks that they're performing, like talking to someone at the same time. Or if we feel like, with trekking poles that could help with actually getting a better arm swing or more stability, we might break that recommendation. So if you're interested in going to a physical therapist, usually you will need a referral from your doctor or advanced practice provider. Like I mentioned at the beginning, it is beneficial to find someone who specializes in working with people with Parkinson's disease, or who specializes in working with people who have neurological problems. Some clinics and insurance companies don't require a referral, just FYI. North Carolina is a direct access state, so you could always call the clinic that you're thinking about going to and just asking if you can just walk in rather than actually getting the referral. However, at this time, Medicare does require a referral even for practices that are direct access. So call ahead and find out. We like to say that exercise is medicine, and we tell people all the time, we want you to think about getting your daily dose of exercise, just like you think about, getting your daily dose of your other medications. It's that important. We know that exercise can improve mood and cognition in people with Parkinson's. It can improve mobility, and it can actually also help to slow the progression of Parkinson's symptoms. And this cartoon just helps to highlight what I'm talking about here. So the person goes to the pharmacy and holds up the prescription and says, "Exercise is the best medicine. Jump." We do recommend about 2.5 hours of moderate intensity exercise per week for people with Parkinson's disease. This can be broken up, into 10-minute segments or 30-minute segments. We do know that anything is better than nothing. So if what you can do right now is 10 minutes, start with 10 minutes. See if you can slowly and gradually add from there. There's a wonderful booklet from the Parkinson's Foundation that has specific exercises that are recommended, as well as kind of general information about exercise. And if you just Google fitness counts and Parkinson's Foundation, this will come up. You can download it, the digital version, or you can actually order the physical copy. It's free and it comes right to your doorstep. And I just want to highlight that there are lots of different ways to exercise. So we encourage people to have fun and do something that kind of sparks joy. So it could be, dance or Tai Chi or boxing, rather than just going to the gym and riding the bike. There are some, Parkinson's specific exercise programs and classes out there. So some people, tend to kind of go towards those types of classes and programs. But, the other types of just community taught classes can work really well for people also. If you have any questions on the content that I presented, or any other kind of general questions, please feel free to reach out to me. My email address is elizabeth.buxton@unchealth.unc.edu. And thank you so much for your time and attention. Take care.